everyone, and welcome back to the series Just What Can a GP Do? In this episode we'll be speaking to Dr. Julie Hammond, who has an amazing portfolio career. Dr. Hammond is a GP and advanced medical facial aesthetics and skincare practitioner based in Kent and London. Dr. Hammond graduated with a distinction in clinical practice during her medical degree and also holds a BSc in psychology from King's College, University of London. She has a special interest in women's health and has obtained the diploma of the Royal College of Obstetricians and Gynecologists, the Dr. Cog. She is also trained in joint injections and minor surgical procedures. Dr. Hammond established Dr. Hammond Aesthetics in 2018. She offers a full range of rejuvenating medical grade cosmetic treatments ranging from anti-wrinkle injections and skin peels to facial contouring using dermal fillers to restore and maintain healthy, youthful and beautiful skin in patients of all skin types and tones. Dr. Hammond believes that every patient is unique and that in order to treat a patient successfully, we need to look beyond the patient's physical appearance. She is dedicated to offering a holistic approach to each and every patient to ensure she creates natural looking results and delivers the best possible care and experience at every visit. So before we get into the video, if you like this video and want to see more of it, then like and subscribe.
I am Dr. Julie. I'm a portfolio GP based in Kent and London areas. And I'm also the CEO of Dr. Hammond Aesthetics. So I set up Dr. Hammond Aesthetics in 2018 whilst I was an F2 doctor. So this is my second year of being fully qualified. I'm just here today just to give you some insights into the career and how I got started and let you know about some of the potentials in terms of growing your business. In terms of how I got started, I did a course. It was a 2-day course. It was foundation training where I was taught about the fundamentals and the basics of Botox and also dermal filler as well. So if I remember correctly, I think my course covered Botox of the upper face and then also about doing lip fillers as well. I don't remember it going into much more than that. So it was just literally a 2-day course. And then after that, you're just set off into the world. And if I'm being completely honest, I felt absolutely overwhelmed. I didn't know how to get clients. I think I just about got my medical insurance to cover my cosmetic work, but I didn't know how to get started. So I really did rely on friends and family. And then I tried to get some models as well, just to get some practice and also just to get some images and content in order to promote my work. And then the second thing was about where do I get started or where do I actually do my work in terms of my practice. So I started to reach out to different salons in the area where I lived at the time, just sending them out some emails. Many people didn't get back to me, but there were one or two who did get back to me. I went to go and see the space. At the time, I was happy to work on a commission basis. Again, because I was a new starter, I didn't want to be stuck in paying, I don't know, £400 a month. And I don't know if I'm going to actually have any clients. So we agreed to, I think it was 15% commission at the time. So it sort of helped them promote me as well, because if they promoted me and I had clients, then obviously they'll get a bigger cut as well. So I think it works for both of us. So that's how I got started. And if I'm being honest, it was really slow, really, really slow. I think for the first year, maybe aiming to have about, two free clients per week, if I'm being completely honest. Obviously, it did go in waves. There were some weekends where I was definitely a lot busier, but that's how I started. Really, really slow in terms of just growth of the business. But then I found that over time, for me, especially because I'm not big on social media, although I'm working on it, I found that a lot of my referrals were from my existing clients. So they would bring their friends, their mum, their sister, they'll just recommend me to work colleagues. So that's how I managed to build up my client base. So yeah, that was like pretty much my first year in terms of growth. At the time as well, when I did get started, in addition to obviously working in the salon as well, I then also saw some clients at home. I had like a set clinical area where I was able to see clients. So I think that also helped in terms of just keeping my overheads low. And I only do aesthetics 1 day a week. So I do it on a Saturday. I think for me, I I think at the time as well, I was in full-time GP training, so I couldn't do it during the week. So I only could do it on a Saturday. And then by seeing clients at my home, I could see a few clients in the evening as well, which again added to the growth of my business. I know not everyone will feel comfortable with that. And I think at the time I did it, but I don't think it's something I'll do now. I mean, I've had clients who are like, can I come over to your place where you're living at the moment? I told them no, that I did want to separate it after a while. So yeah, it's just something that people can bear in mind as they grow, and they might decide that. I know some people have had like a garage set up and then they make that their clinical space. But I did want to just separate the two for me. As I continue to grow, especially meeting people I haven't met before, I thought it's just better to separate the two. Okay, so I mentioned earlier that I did my 2-day course and I was sort of lost in terms of how to begin. So something I forgot to mention was that I actually went on to have another I went to go and pay for a mentor in the industry. So they actually booked me a clinic full of clients, and they observed me as I was doing procedures on different clients, taught me different techniques. And I think that really did help to elevate my aesthetics career. I think just doing that foundation course, there's so many treatments that people do want to come to you for, and you pay for the foundation course. And yes, there's advanced courses, but they're all in separate little sections. So there's a separate course just to be able to do liquid rhinoplasty. There's another course just to do the jawline and the mid-face. So it does add up and it's really expensive. So I found that for me, it was better for me to pay for a mentor who got me all of these clients and was able to show me how to do it, and then observed me doing it as well. And it really did help build my confidence, and also it helped me to gather some initial images for my portfolio as well, because that's what clients want to see. When you first get started, they ask, can you show me some of your work? And if you have nothing to show them, it's going to be really difficult to progress. So I think that's something I would recommend as well to people when they get started. So it is a big payment. I'll say it's probably about $5,000 startup cost. So it's a big investment if you're going to do it. And yeah, I think you can't just do the foundation course and expect to be successful. I think you do need to do some additional training. And even after doing that course, I still go on courses year on year just to keep updated and just learn different techniques as well. Again, when they taught me how to do the treatment, they taught me how to do it with a needle. And then there's certain treatments that I found that, I want to use it. I prefer using a cannula now, just because I find that it's less risky. And I just find you get a better result and it's more comfortable for the patient rather than giving them loads of injections. If I just make one little entry point, put the cannula in, they find it a lot more comfortable and it's less likely that they're going to bruise as well. So I find that's what I've learned over the years in terms of my training. And even now, there's other treatments that I want to learn and train in as well. So it's ongoing course, it's ongoing investment. So, and it's no way a way of making quick, easy money. And everyone, to be honest, that's why I did it first of all. I'm not going to lie to anyone. I was locuming quite a lot as an F2 doctor, but I was doing 13-hour shifts, running up and down the hospital, and I just found that I was exhausted by the end of it. So I thought, let me go and do this course. It'll be quick and easy to make money. And if I was honest, it wasn't that quick or easy. And I found that the reason it worked well for me then as well is because my earning potential as a locum or bank F2 was a lot lower. So even if I just saw 2-3 people in a week and I made, let's say, £300 profit, I was happy with that because I was an F2 doctor, and that was good for me at the time. But then as you continue to progress in your career, I find that now it's a lot more tricky to make it worth my while now. So I think it's easier to get started when you're earlier on in your career than when you're later in your career, because you do have to invest a lot of time and effort and money. And it can be more tricky because right now, if I go and locum as a GP, I can make, easily, £700 to £800 per day. And then if you're starting off in aesthetics, you're making £200, £300 a day, weighing it up is quite tricky and it's difficult. In terms of earning potential in aesthetics, I think it is uncapped essentially. It depends on how much time you're putting into it. Like I mentioned, I do it 1 day a week just because I'm working as a GP during the week, and also I do a lot of work in health equity as well. So if you're doing it 5 days a week, you can make well over 6 figures depending on how busy your clinic is. So I think the main thing that you should aim for when you're pricing your treatments is that you should be getting at least £100 profit per treatment. So again, clients may come in and they might do multiple things. So you might get a client coming in who's doing a bit of Botox and is doing fillers in different areas. So whatever you're pricing, just try to price it so you get about £100 per treatment. And again, I think it's always good to offer packages as well, because I think that draws people in. So I think, filler packages is always a good thing to do, because it's not often when you're treating a client, it's not just one area you're treating. You're thinking about, aesthetically how to improve them overall. So you might need definitely more than one more for most people. So I think having a good package deal will allow you to obviously get better results for your Instagram, which is also helpful in terms of your social media. You want to have good results so you can actually show off and say, look at my work. So I think that's also a good way of increasing your earning potential as well, by just offering different packages so you can really show the extent of the work that you're able to do. So my top tips for anyone getting started in aesthetics would be, first of all, tip number one, after you've done your training, that you should start immediately the day after, start emailing different salons or different spaces just so you can secure that space. I just feel like you just need to get started straight away. I think when you sit there and start thinking about it too much, you do nothing and it doesn't happen. So the statistics is that for 50% of people that do the course, they won't get started in aesthetics. They'll just pay for the course, which could be 2-3 grand, and then they won't do anything with it. So I think the most important thing is just to, the minute you finish, just start emailing different sites and try and secure some models just to start building up your social media. So just get started straight away. That would be my first tip. My second tip is that it's not a quick way to make money. So, and you do have to do some investment. So even after you do the foundation training, I'll then advise that you do some additional training. So perhaps probably pay for mentoring or pay for some of advanced courses. I think just shop around in terms of who you're looking at and what courses you want to do, because different places offer different things. So you may go with the more popular courses, but they might not offer you as much training. So I'll try and go for a training course that offers you training where there's maybe 3 of you, so small groups, so you get a lot of hands-on experience when you're doing it, so you feel a lot more confident when you leave. Just from my experience on the course that I did, there was about 10 of us with one model, and it wasn't very helpful. So I would advise that make sure you really read the fine line in terms of what you're going to get out of your course as well. And my third tip would be just persist, just persevere. You might have some difficult clients, especially in the beginning when you're building up your confidence, but I just think just keep on going. It might be a bit slow to begin with, but if you keep on going, the referrals will come in by itself. You'll eventually build up a big portfolio, and it can grow into something that is profitable for you. So in terms of where you can find me, I'm based in the Kent area. So I'm working in Blue Water in Gorge Beauty Salon there. And then also I'm working in Gorge Beauty Salon in Strood as well.
I hope you enjoyed the video, and if you have any questions or comments, then please drop them in the comment section below. And as always, give the video a thumbs up if you liked it, and subscribe to see more of the same content. I will see you in the next one.